Is the DRDO's new medicine 2DG going to be a game changer in case of COVID-19 virus? The first batch of COVID-19 2DG was released on May 17, 2021 by the Defense Minister Rajnath Singh and Health Minister Harshvardhan. It is said that 42% of the patients were taken off oxygen, which means that oxygen supply was stopped to them. They did not require it when they were administered with 2DG. Similarly, in case of severe patients, which means patients who were severely affected by COVID-19, they showed improvement when the drug 2DG was given to them. Thirdly, the good thing is it can be given to patients above 65 years of age and many more. So let's learn what exactly is this 2DG. Well, 2DG is DRDO's new anti-COVID oral drug. Yes, you heard it right. It's not a vaccination, it's an oral drug. It is manufactured by Dr. Reddy's and it has been developed by INMAS. Let's quickly look into the life cycle of how 2DG came into being. Well, in April 2020, when India was first hit by the first wave of COVID-19, DRDO discovered that 2DG is halting, or it's kind of stopping the progression made by the COVID-19 virus inside the body cells. So very quickly in May of 2020 itself, the permission was given for clinical trials, the first phase, the second phase and the third phase. The second phase was completed towards the end of October 2020 and the third phase was started very soon. The 2DG drug as a cure of COVID-19 was finally released on May 17, 2021. Well, let me tell you about clinical trials. Any vaccination or any medication that has to be given to any human being must go through at least 3 clinical trials, and there are different phases, and only after successful completion of clinical trials can it be given to human beings. Finding the perfect information was not easy. I had to do a lot of research and I came across that there is a registry which is maintained for any clinical trial that has to be administered or has to be undergone must be registered with Clinical Trials Registry of India, that is CTRI. I will leave a link to the website in the description below if you want to go through that. And I used to think there would be very few medications which are being tested or the clinical trials are going on COVID-19 solution. However, I came across 1250 different search results when I searched for clinical trials for COVID-19 only. As far as the first clinical trial is concerned, I did not get any information on the website that I just mentioned, so I would rather not comment on it. So let me talk about the second clinical trial. The sample size was 40 people, all the 40 were Indians, and some newspapers or some news channels are saying that it was again 110 or something more than that, but based on the data that I got on CTRI's website, it said the sample size was only 40 people and the age was 18 to 65 years old. I would like to say the final outcome was good, hence it moved into the third clinical trial. Here you can see that in third clinical trial of 2DG, 220 people underwent the sample or the clinical trials, and the age of candidates was not 18 to 65 but 18 to 90 years. So which is again a very good thing. Well, again it came out to be successful, and only after that the success was achieved in the third clinical trial, it was released by the Defense Minister for common public. Well, let us understand what exactly does 2DG does. Do you remember the concept of Trojan horse? How a big wooden horse was built and it was sent into the city of Trojan, and this big wooden horse was actually holding a lot of soldiers and took over the entire city of Trojan. Well, in a similar manner, when the virus has to replicate or when the virus has to multiply, it needs a lot of energy, and this energy is coming from glucose. So what 2DG does is it is actually a form of glucose itself. Hence, the 2DG drug, like glucose, spreads through the body, reaches the virus infected cells and prevents the virus growth by stopping viral synthesis and destroys the protein's energy production. It means, like a Trojan horse I just discussed, the glucose is the actual enemy of the COVID cells or the COVID virus. The drug also works on the virus infection spread into lungs, which helps us to decrease patients' dependability on oxygen. And that is the reason the claim that 42% people were taken off oxygen after using just 2 sachets of 2DG. So right now we don't have a lot of data. Only 10,000 sachets have been released by the government. So I guess once this drug is used on more number of people, we will have an accurate data on the efficacy as well as how good the drug is. Well, now let's discuss about some of the things you should know about 2DG. How can 2DG be consumed? It is in powder form. So like any other glucose solution, you can just mix it with water and take it. There are instructions on how much powder has to be consumed with respect to the body weight, and you can simply mix it in water and drink it. How many times do I need to take the 2DG sachet? You need to take it twice in a day, that is in the morning and in the evening, to be more effective. How many days do you need to take the medicine? Well, currently it is being said that you need to take it from 5 to 7 days, 5 days minimum and 7 days depending upon the severity of the infection to get completely cured. In the clinical trials, high number of people who took the dose showed to be RT-PCR negative, which is again a very good thing. So do you also believe that yes, the 2DG drug, the Indian 2DG drug is going to be a game changer? Do let me know what you think in the comments below. What I feel is that if it comes out to be the way it is expected, then it will be a game changer and the entire world will salute to India and India's DRDO. One of the questions that some people have asked, can I just take 2DG drug or do I need to get vaccinated? Well, there is a very big difference between the role of vaccination and the role of 2DG. Vaccination is to help you build immunity, and the 2DG drug is the cure for the infection if you are infected. I've already made a video on what kind of vaccination should you be taking and how you can decide whether you need to take Covaxin or Covishield, which is available in India, or you should wait for Sputnik or Pfizer when it is available in India. I will leave a link to this video in the end screen in the description below and on the link above. And also you must watch another video of mine, which is where a lot of myths have been exposed or busted regarding the vaccination of COVID-19. Believe me, I have heard things like having a vaccination will make you impotent and you will not be able to have a baby. Can you just imagine in 21st century and you are still having myths like that? Well, I will leave a link to this video as well in the description. Go through them. Do subscribe to my channel so that you keep getting the latest information. And thanks a lot for watching the video till now. Share with your friends and family. Take care. Bye bye.